Hi everyone, today I will introduce the MS implant, a one-body implant designed for narrow bone widths. For reference, MS stands for micro-solution. The surface lineup consists of SAW and RBM types, and the implant features an integrated structure in which the abutment and implant body are combined into a single unit. The lineup includes specifications such as the narrow ridge type for use in most narrow bone width cases, the denture type for overdentures, and the provisional type for fabrication of temporary prostheses. Let's look at the benefits. The first benefit is the availability of a minimum diameter of 2.0, which allows placement even in narrow ridge widths as small as 5 mm. When using the 2.0 diameter in a 5 mm narrow ridge, a clearance of 1.5 mm can be secured on each side, enabling implant placement without the need for bone grafting. In addition to the 2.0 diameter, 2.5 and 3.0 diameter options are also available. As shown on the right, the upper portion is designed with a prepped anterior shape, allowing minimal intraoral reduction for greater convenience during use. In addition, the abutment diameter is 3.0 mm, making it suitable even in cases with narrow interdental spacing. Additional space can also be secured by adjusting the implant placement depth. The second benefit is that, despite its small diameter, it provides reliable primary stability. Below is the test data for the smallest 2.0 mm diameter model, demonstrating that stable initial fixation can be achieved even in normal bone or hard bone conditions in the mandibular anterior region. By optimizing the insertion torque values of the dedicated MS kit and MS implant, the system can be used safely and reliably. The third benefit is that, despite its small size, it can be used safely due to its excellent fracture strength. It is manufactured as a one-piece structure with the abutment and is made from high-strength grade 5 titanium, providing outstanding durability and strength. As shown in the image on the right, fracture testing was conducted on the 2.0 mm specification. In static fracture testing, it demonstrated higher strength than competing products. In fatigue fracture testing, it demonstrated over 80% higher fracture resistance compared to competitors. In cases with narrow ridge widths where the use of a small diameter implant is unavoidable, we recommend choosing the MS implant as one of the safest and most reliable options. The fourth benefit is its wide range of lineup options, offering excellent clinical versatility. First, there is a specification designed for overdenture cases in edentulous patients with narrow ridge widths. The upper portion is designed in a ball-type configuration, allowing the denture to be fabricated using the existing stud-type O-ring and retainer cap interchangeably. In addition, there is a provisional type designed for temporary prosthesis fabrication. If a temporary restoration is required after surgery, the provisional implant can be placed and used to support the prosthesis. The upper portion is also bendable, allowing angle correction of up to 30 degrees. However, please note that repeated bending is not recommended, and the component should only be bent once. Next, let's briefly look at the prosthetic workflow for the MS narrow ridge system. After placing the MS implant, a temporary restoration can be fabricated by connecting a temporary cap to the implant. Because fixation can be achieved without additional cementation, it can be used conveniently. In cases where the interdental space is too narrow to use a temporary cap, a temporary restoration may also be fabricated directly with resin. At the final prosthetic stage, the impression coping is connected to the implant, and after taking the impression, a working model is fabricated to proceed with the final restoration. You may understand this workflow as being similar to fabricating a prosthesis from an abutment-level impression in a conventional two-piece implant system. Next, let's briefly review the components of the dedicated MS kit and the drilling sequence used for the MS implant system. The MS kit has a simple configuration, consisting of a lance drill for initial positioning, a final twist drill, a parallel pin for checking the angulation and path direction, and drivers for implant placement. During placement of the MS implant, the implant and driver may occasionally become stuck together. To address this, the kit also includes a separator for easy disengagement. The image illustrates the drilling sequence for the 2.5 mm diameter implant as an example. Depending on the bone quality, the lance drill is optional, but its use is generally recommended whenever possible. This is because starting directly with the twist drill may cause the drill to slip, whereas the lance drill helps establish the correct position, angulation, and depth. It is also helpful to use the parallel pin to verify the drilling direction and depth before proceeding further. After that, the osteotomy can be completed with the final drilling step according to the bone quality. That was all about the MS implant. Thank you.